Health inequalities inform policies, programs, and practices. Looking at patterns in disaggregated data can help to indicate the best approach to address inequality.
This figure shows 4 patterns of disaggregated data: complete coverage, marginal exclusion, mass deprivation, and a linear pattern. In this example, we view the percentage of births attended by skilled health personnel, disaggregated by economic status, in 5 subgroups. The circles on the graph represent countries. Each country is shown on the graph by 5 circles. The black horizontal lines are the middle point, the median of data within each subgroup. By using the selection menu, we can customize the view to show which countries demonstrate each pattern of inequality. First, let's select complete coverage.
These countries have coverage of 100% or close to 100% across all subgroups, from the poorest to the richest. I see that the circles representing each subgroup fall on top of one another close to the 100% mark. Clearly, these countries have almost no economic-related inequality in coverage.
That's right. These countries should focus on continued monitoring of this indicator to ensure that coverage remains high for all. Now, let's view the countries that show a marginal exclusion pattern.
I can see there is much lower coverage in the poorest subgroup compared to the other 4. The red circles, which represent the poorest subgroup, fall far below the other 4 sets of circles.
These countries should consider adopting policies, programs, and practices which are targeted and allocate extra resources to the highly disadvantaged subgroup. Moving on, let's select mass deprivation.
Here, most of the population, that is all but the richest subgroup, have low coverage. I suppose the response should be universal targeting, as most of the population is underserved.
That's right. Mass deprivation indicates the need for universal targeting. The final selection is a linear or queuing pattern.
These countries have a pretty consistent increase of coverage across subgroups, although the coverage is not exactly equal in all of these countries.
For this reason, these countries should focus their efforts on a combined approach to increase coverage in all subgroups, with special emphasis on the poorer subgroups.
This short demonstration has provided examples of patterns of inequality in births attended by skilled health personnel, disaggregated by economic status. The data used here are the latest available data gathered in international household surveys between 2005 and 2012.